My name is Magdalene Tot, a clinical nutritionist at Good Life Pharmacy. Today, we want to talk about nutrition and weight management. In weight management, we have to check the aspects of BMI, whereby we calculate your BMI with your weight in kilograms and your height in meters squared. A healthy BMI ranges between 18.4 and 24.5. Anything less than 18.4 is considered as malnutrition, and anything above 24.5 to 29 is overweight. Above that is obesity. Malnutrition is a condition whereby your body does not have enough nutrients and minerals to sustain a healthy living. On the other hand, when your BMI is high, it predisposes you to conditions such as diabetes, high blood pressure, gout, and many other conditions. At Good Life Pharmacy, we have a wide range of supplements which will help you manage your health. We have immunity supplements such as the vitamin D, C, zinc. We also have multivitamins for both men, women, and children. We also have mineral supplements such as iron, magnesium, etc. You can walk into any of our Good Life pharmacies and get comprehensive nutritional counseling. You can also register as a club member and enjoy instant discounts.
Hello and welcome to Health and Wellness. My name is Zaitun Ali, and today we're coming to you from the Fairview Hotel right here in Bishop Road, Upper Hill. And the discussion is about breast cancer. So it's October, and you know it's a month of breast cancer awareness. And basically the breast has three parts. It's the lobule, the duct, and the connective tissues. So we talk about the lobule being able to produce the milk, the duct being able to transport the milk, and the connective tissues holding everything together. So now when breast cancer comes through, it means that most of the cells inside there are growing out of control, and they start at the duct and the lobule. Yes, so on my panel to help me dissect this reality, I have Dr. Gloria Omondi, who is a medical oncologist at the KNH. I also have Mercy Jim, a caregiver at the Kilele Health Association, and Eunice Wambua. She is a survivor of this condition, the breast cancer. Karibuni sana.
Asante.
Daktari, I'd like to start with you. Just to break it down to us, what is breast cancer and what does it entail?
Okay, so breast cancer, like the name suggests, is a cancer.
Yeah.
Cancer is a malignancy. It's an abnormal growth that starts somewhere in your breast, one side, the other side, or both sides. And what happens is normally starts in one cell, and then it grows abnormally, out of control. Your normal cells have a way of controlling themselves, but this one is abnormal, so it cannot be controlled. It's an abnormal growth in the breast that starts in the breast.
Okay.
It's the commonest cancer we have in females in the world, and even in Kenya, it's the commonest cancer. So I'm very glad you're talking about it today, especially being our month of breast cancer.
Yes, it's actually October, the month of breast cancer awareness. And Mercy Jim, you can talk to us about what caregiving is, especially in this condition.
Well, with caregiving, we start with the patient right from the doctor. Once they get the news that they have cancer, breast cancer, we start with them. We do the counseling first, then we start navigation. Navigation, we do it from right from the hospital, then we start doing the medication. We make sure that they take the medications as is said at the hospital, yes. Okay. So caregiving is taking care of the patient and the family, yes.
That's a good one. Eunice. You can give us your story of when you were first diagnosed with this condition and how was it for you?
I was first diagnosed with breast cancer in 2016. I felt a lump in my right breast. Then initially when I went for the first screening, the doctor assured me all was well. I was good to go. But then after like a year, the pain came back, so I went for a second diagnosis. After the second mammogram and an ultrasound, it was confirmed that I have some abnormal growth. Then I went for a biopsy. After the biopsy, it was confirmed that it was breast cancer. Initially, I was in denial, so I was forced to see several oncologists. It was stage 2B. The last oncologist that I saw assured me that cancer is treatable here in Kenya. It's only a few tests that you can do outside Kenya. Then after that, I started my journey with cancer. I first did a surgery. After the surgery, I did chemo. After chemo, I did radio. After radio, I was put on hormonal therapy. And I've been on hormonal therapy now for like 6 years.
Okay. And how has it been for you, Daktari, treating cancer patients?
That's a good question. First, we see very many cancer patients, Kenyatta being the largest cancer center in Kenya, actually even in the region. It's a mix. It's a mix of goods. There's a good side of it. There's a sad side of it. But overall, I'd say it's actually a good. Especially now that cancer care is getting better, you're getting better therapies. It's actually very exciting. I look forward to treating cancer patients. So I'd say overall, it's a very good for me. I like it.
Yeah, and what causes this condition?
Oh, what causes cancer? That's a big question everybody asks. What causes cancer?
Especially breast, yeah.
and if people would know, you'd just keep away from whatever causes cancer.
Yeah.
So is there anything particular that you'd pin down and say this causes cancer? Not really. But we know there are things that increase your risk of getting breast cancer. That's what we know. There's no particular thing, don't take this and that, but the things that increase your risk. And interesting enough, the biggest risk factor for cancer is your age.
Really?
Yeah, it's your age. You'll rarely see a teenager get breast cancer, but once you hit your 30s, your 40s, your 50s, so one of the risk factors is just your age. Some things you can't modify. You know, we call it non-modifiable, but your age you can't modify. Once you grow, that's why we start to screen for cancer once you get over 40. There are things that may increase your risk of cancer, like using some hormones, just generally having an unhealthy lifestyle, obesity, taking too much alcohol. Those can increase your risk that you can change. But you also have some people who just have a family risk of getting breast cancer. Sometimes you can see that they have an increased risk. If you track the family, you can see the sister had breast cancer, the cousin. So some people have a familial risk, but that's a very small percentage of people.
So it's not right to say it's inherited?
I wouldn't say it's inherited, but there's a family risk. You can have a family risk of getting breast cancer, yes.
Okay.
Yeah.
And Eunice, when you were diagnosed with this condition, at what age were you?
Was 41.
41, eh?
Yes.
And what were the early symptoms that you showcased?
The early symptoms that I had was I felt a lump. That was the very first thing that I felt, a lump in the breast. Yes.
Okay. And that was
It was
2016?
painless, yes. It was a painless lump in the breast.
Okay.
Yeah.
You can take us through maybe the treatment process in terms of mentally, well-being. How was it for you?
For me, it was very hard because in the initial days, I felt that I was dying because that is what the society feels about cancer.
Yeah.
And when I tell a friend, a family, they would just get scared of it, and most of them believed that I was not going to make it. And that made me also believe that I'm not going to make it. And the initial days, in fact, I waited for death to come. I slept every day knowing that I'll not wake up the next day. So I waited for 1 day, for 2 weeks, a month. It went into a year. Then my turning point was when the year was over. It's when I believed that now this death is not coming as fast as I expected. So that was my turning point.
Talk about this turning point.
My turning point, I met several other cancer survivors. there is an association called Faraja. So I went to one of their functions, and that is where, in fact, there's another lady who really encouraged me because she had survived cancer for like 36 years. So when I heard her talk about her experience with cancer, it made me see that there's life after cancer. Then after that, now I started, during the initial days of my treatment, I was in denial and I had isolated myself from the other people. So I only thought that I am the only person who is going through cancer treatment, and I'm the only person who is dealing with that challenge. But after that, that was my first cancer support group that I came across. Then after that, now I met some people from Kilele. I met some people from another called Symbol of Off. I met others from the Leukemia Association of Kenya. Now that one at least showed me that it is not a situation that I'm going through it alone. There are so many other people who are going through that situation, and there are still others who have gone through the situation and lived after the experience of the cancer situation. It is emotionally draining. It has a lot of stigma. There are so many people talk about it like
It's a deathbed.
And it is a deathbed. And in fact, the worst part of a person like me, my employer also believed that I was dying. So he also went to the extent of terminating my employment.
Are you serious?
So the society treats cancer like, once you are diagnosed with cancer, you are treated like a burden. Yes.
Pole sana. And Mercy, we can talk about the care that you give to such patients when they come to you. What does it entail?
Well, in such circumstances, at first we have to learn everything to do with breast cancer. So we get to learn the risk factors, what they should do when they go to the hospital, the mammograms, the scans, and what they should what they should be looking forward to when they start the chemotherapy. So we take them through all these processes, and you have to have that grace and patience, because sometimes they get angry and they deal with the stigma in their own way, so they are depressed most of the times. So you have to give that care. Yes, that is what generally it entails, and it's a lot of work. To move with a patient from probably like her from 2016 to date, she's still on medication, so you have to move with her all those years. Yes.
Okay. Daktari, who is eligible for the clinical trial when it comes to breast cancer?
I'm glad you've asked that question.
Yeah.
Because I get a lot of questions from the patients that we see about clinical trials. First, when you tell a patient you need to go for a clinical trial, many people are skeptical and they think, are you going to test something on me? So that if it works, you can give others. So there are many clinical trials, even in the country. Some are done locally, some are international, meaning we have patients from Kenya together with other centers being tested in a clinical trial. So basically, what I'd say, a clinical trial is where we have very closely monitored treatment. Okay, very closely monitored treatment in order to objectively know the efficacy of a drug, how well it works. You want to know the safety of a drug. So in a clinical trial, it doesn't have to be a new drug actually.
Yeah.
It can be a drug that we have all used, for example, but I just want to compare drug A and drug B objectively and get results. So normally in a clinical trial, you have very clear criteria where you know it has to be a breast cancer patient, she has to be this age, it has to be this stage and this type of breast cancer, because breast cancer is not one disease.
Yeah.
There are very many types. And you get them in if they meet the criteria, but there's also normally an exclusion criteria. So you will say you will not qualify because of your age, maybe because of your cancer or something like that. So if I was to give you an example, there's a drug that works in this type of cancer, but not in another type of cancer. So we'll make sure that it is a type that works for your cancer. Then you'll be eligible if you don't meet an exclusion criteria.
And for breast cancer, what types do we have?
We have many types of breast cancer.
Yeah, maybe just briefly.
Even if I was to just simplify the cancers, I would say that those that are driven by hormones.
Okay.
Okay, that those that are driven by hormones. So that usually we treat them with hormones, like Wambua said. We treat them with hormones. Part of your treatment will be hormone. But some patients have something else that we call HER2, for example. So we'll give you HER2 therapy. And then there are those that are not driven by hormones, they're not driven by these other things, so we call them triple negative cancer. If I will just to briefly explain, so you don't have any targetable things, so to say. Yeah,
and
those are the main ones. Yeah.
Okay, for that treatment, who will be in this team treating these patients? What does the team consist of?
Oh, yeah. Actually, breast cancer is one of those cancers that must really be treated by a group, a multidisciplinary team. So right from diagnosis, you'll have your doctor, just a general doctor or whoever, just palpating whatever we presented with, and then they'll send you for your biopsy.
Yeah.
The biopsy is normally done by a radiologist or a surgeon. Okay. Then once the diagnosis for cancer is made, you'll either be sent to an oncologist or to a surgeon. Okay. So depending on the type of your cancer, the stage, and many other things that we consider, you can either have surgery first or you can have medicine first. That's where oncologists give the medicine. So you have the surgeons, you have the medicines, and then after that, you can also have radiotherapy. So that's where your radiation oncologists come in. But beyond the doctors, we still have very important people, by the way. We have equally important are your counselors, because most people still equate cancer to a death sentence, which is not, it's like that in it's not always like that. Actually, cancer patients need to be taught that cancer is not necessarily a death sentence. Actually, most of the time, it is not a death sentence, and you need to be taught how to live with it, how to accept the diagnosis and start your treatment. So we have our counselors, our nurses, our navigators, we have our pharmacists. It's
like in Amasi here, the caregivers.
Yes, they do a very important job, actually.
So for Eunice, you went through the surgery first? Okay. Talk about the surgery and maybe the side effects it left you with before we take this short commercial break.
The surgery involved removing one of my breasts, and it really affected my self-esteem because, in fact, from time to time, I used to ask my surgeon, after you remove the breast, will I be a man or I will be a lady? Because with one breast, when you walk around, people look at you like a scarecrow. They wonder what is wrong with you, because it's not always when you will go around telling people I'm suffering from this, I'm suffering from this. So the surgery was, to me, I had to undergo the surgery because it was a medical requirement, but given the opportunity to make a choice as a lady, I could not have accepted to undergo the surgery, because even after today, 6 years later, I still feel I lost a part of me. And minus the surgery, minus the breasts, you are now forced to use a prosthesis. The prostheses are very expensive. What are these prostheses?
The prosthesis. And just to mention what she said, actually, breasts are very feminine. And amputating a breast is something that has been recognized as a very deep issue. And nowadays, actually, cancer care is really encouraging sparing of the breast. Seriously encouraging sparing of the breast. So for most patients, unless the breast has to be removed, or if a patient wants the breast to be removed, we really look towards breast conserving treatment, because when you have cancer, most of the time it's not like the whole breast. You probably felt a lump somewhere, isn't it? Yeah. So what can be done? You can actually just have just the area with the cancer removed, and it is as safe. Yeah, by the time it's being done, it is as safe, and it has there's no difference between removing your whole breast and removing just the lump. Of course, there's a lot of things that we look at before they just do the lumpectomy, but beware that there's a lot that can be done. You don't need to remove. Actually, like in Kenyatta, it's very, we don't remove whole breast unless the patient is okay. Sometimes you get a 90-year-old lady with breast cancer, just tells remove all of it. What am I doing with this? Yeah, but we are very sensitive to breasts in ladies, and we discourage unless a patient wants. It's just the lump that is removed, and beyond that, if your breast has to be removed, the whole of it, we still have reconstruction therapy.
Yeah. We want to take just a short commercial break, and we'll come back with what Dr. is saying about the reconstructive surgery. But again, also Kilele Health have brought some items here of which we'll be talking about them, and we see how to just deal with this reality. So we're taking a short commercial break. We're coming back. Don't go anywhere. Welcome back. If you've just joined us, this is Health and Wellness. My name is Zaitun Ali, and we are speaking about breast cancer. It's the month of awareness. It's October, and we've talked about the diagnosis, the symptoms, the treatment, and now we just want to see the side effects and the resource care just given to these patients as you're going on. Remember, the SMS line is 22151. In case you have a question to our experts right here, shoot them. We'll be sure to answer them right here on the show. Karibuni sana. And Dr. we were talking about the treatment plans and how it goes. So what are the side effects and the outcome of this treatment?
So there are different modalities of treatment. So if I would start with surgery, surgery is safe. People say, I mean, it's say that it is easier to die on a Kenyan road than to die on a theater. So surgery is safe. I know many people fear.
People say that.
It is actually true. Yeah. Okay. But many people fear surgery. Yeah. And most breast cancer patients who need surgery actually in good general conditions. So surgery by itself, the procedure is, I would say, safe. What you have after the surgery, the pain is usually very well controlled. Occasionally you have a wound that takes a bit longer to heal, but most heal in good time. Occasionally, again, you can have some fluid draining for a bit longer, but that also usually resolves. Sometimes because you have to remove lymph nodes if they have cancer, you might have swelling on one hand, on that side that is affected. So that's usually one of the commonest things that our patients complain about. And beyond that, we can't underestimate what she mentioned about that is psychological effects of not having one breast.
Sure.
So we need to deal with that. But you need to remember, surgery is actually one of the ways of curing cancer. After surgery, we have chemotherapy, and this is where people really fear chemotherapy. So yes, chemotherapy is medicine that's given to kill the cancer cells. So what it does, it kills the cells that are growing fast. But unfortunately, some cells in your body also grow a bit fast, like cells in your GIT, they track the alimentary tract. So you can get, one of the commonest things is just nausea, vomiting, malaise, sometimes you can get diarrhea. With some drugs, it depends on what you're giving, some heart effects, some nerve issues, you can get numbness with some types of drugs that we give. What is usually seen, usually hair loss, we don't like that. But for each side effect, we actually monitor. we monitor and we try to mitigate it. There's a lot we can do. For example, the nausea and vomiting, there's so much we give you. By the time you're getting a chemotherapy, you have like 4 other drugs you're getting with it, just to make it manageable. And majority of patients actually do well. I think, like you were saying, most patients just need the encouragement till they keep going.
Yeah.
And by the way, patients get the side effects to different degrees. Some patients, you give chemotherapy, and someone once told me, I thought you gave me Panadol.
Oh.
The only difference was the hair was falling.
Yeah.
But some people have it tough, depending on the regimen, and just the differences in patients. But it's also manageable. I would say you don't have to fear it so much.
Okay.
It's actually manageable, and it helps. It really does help. Then after chemotherapy, we have now the targeted therapies and the hormonal therapies. They're a bit lighter with less side effects, and that's where the world is moving. Targeted therapies that you just target the cancer cells using various things. What else do we have apart from targeted therapies, chemotherapy, radiotherapy? Yeah, radiotherapy is also advancing quite well. It's getting shorter. The problem is that you have to do it every day, but nowadays it's getting shorter, so it's much better. You can get burns, because we call it kochoma. It's like radiation burns on the skin, but that's also rare. By the time you're getting burns, it's rare, but you can have side effects, especially depending on where it's involved, some issues, a bit of swallowing, and again, you still end up with lymphedema. We call it swelling of the hand, because you cannot drain your lymph on that side very well.
Okay.
I think those are the commonest that we face.
And before the break, Eunice was just explaining to us, she's a cancer survivor for the last 7 years, is it? And she was suffering from breast cancer. So perhaps maybe you can mention a few of the symptoms that you went through, not symptoms actually, the side effects that you went through that Dr. has mentioned.
The initial side effect that I experienced was falling of air. In fact, my air fell after the first chemo. In fact, the doctor had prepared me for the side effect. She had given me a booklet which had the side effects. So I was psychologically prepared for the falling of the air. So I had just done some small lines, the ones that we do for girls when they go to schools. So in fact, after the first chemo, after like a week, I just slept and woke up and found my hairs on my pillow.
Oh, yeah.
And for your information, there's something that can be done about it nowadays that can actually reduce. We have it in Kenya.
What can we do about it?
We can do what you call scalp cooling. It's just sort of tries to reduce that, make it a bit bearable.
Do you have it at KNH? You can plug guys to come and do it. Yeah, but
it's available.
Yeah. So Mercy is one of our caregivers from Kilele Health, and she has a few things here, items she wants to talk about in terms of offering support and to the cancer patient.
Yes.
Yeah.
Now, as the doctor has told us, during chemotherapy, some hair falls off. Now we use the marvins as you see them here. We purchase them from cancer survivors and we gift them to cancer patients, the ones that are going through chemotherapy, so that they can use them on their head. It reduces the stigma and your low self-esteem. It at least
but inakaa imemea sasa vizuri sana.
In fact, after kuanguka, ilipoanza kumea back, it was like just fine. Kama ile ya mtoto mdogo wa kuzaliwa, inakaa tu smart. But it is weak. It's not as strong. So I shaved for like 1 year. Then after the 1 year, sasa nikaanza kushuka.
Okay.
In fact, this is my natural hair.
Oh, ndio umeka dready? Oh,
it's
nice.
my natural hair.
Nice. Okay.
Yeah, so we have marvins. And then we have these boobies.
Oh.
They are knitted by cancer survivors too. You feel it?
Yes.
Very soft.
Ah, okay.
Very soft, yes.
So kuna sizes. Nikitaka
kuna
kubwa unanipe
sizes.
kubwa.
Yes. Ukikuja na cup D tunapatia D.
Okay.
Yes.
Makes sense.
So we make them here, we give them to wenye wamekatwa, the ones that don't have the breasts. They use the special bras like this. So we have one here that has a booby inside.
So you
The
place
process
this
is-
inside
yes,
of it.
you press inside. You see it's a special bra. It
Yes.
has this pocket. You have to press it inside well. Ndio ukivaa, it doesn't fall off.
Okay.
Yes. And this is for the survivors that cannot afford this. These ones are very expensive.
What do you call this?
A prosthetics too.
Okay.
Yes, just the same as this, but now this is more, looks kind of real. And yeah, it's silicone. You feel it, it's real, feels real.
True.
Yes.
True.
Yeah.
So ni comfortable.
Yeah, very.
Pia unaingisha ndani ya the bra.
Unaingiza ndani ya bra. Yes.
With a nipple.
With a nipple. Yeah, but we also usually put some nipple here so you can see it also has
Okay,
some
that's a
nipple.
good one. If it looks like a breast,
Yes.
feels like one, it is
Yeah,
one.
it is one. Yes. So apart from this, we also offer sensitization about cancer. I'll not say all kinds of cancer, but basically, specifically, we do HPV
Okay.
sensitization and breast cancer, breast health sensitization. Yes.
Okay, thank you so much. And at this point, it feels right to throw the questions now to the audience. They want also to be a part of this conversation. Any question? And we have a male representative right here. That is our #1 contributor. Karibu sana.
Asante sana. First question goes to Daktari.
Maybe tell us your name first.
Robert Marine is my name.
Thank you.
Daktari, this question is for you. I understand breast cancer also happens to men also. Men can also get breast cancer. Are the symptoms the same as those of women?
That's a very good question.
Yes.
Thank you so much.
Yes, very, very good question. Yes, men have breasts, just that they're smaller, so they do get breast cancer.
Okay.
Much less compared to women, but yes, we have quite a number of patients to take care of with breast cancer. The challenge is when a man gets a breast issue, they really think it's breast cancer.
Okay.
But you get more or less the same symptoms. You can have a lump, you can have some discoloration, you can have some asymmetry, you can have some pain in your breast. And so we still encourage men, just as ladies, if you have any lesion, anything in your breast that you are is not usual, please see a doctor, see an oncologist or whoever, a doctor who can advise you. Yes, men get breast cancer. Very good question. Fortunately, men tend to come later. You know, ladies, you know, I have a lump, I run. Is it cancer?
And even before the next question is asked,
Yes.
before the break, I cut you short when you're talking about reconstructive surgery.
Yeah.
So maybe just link it up to that as we go to the next question.
For men in particular?
Both. We can say both.
For reconstructive surgery. So reconstructive surgery, I'm not a surgeon. But first of all, I've said we try as much as possible not to remove the breast. But in case the breast is removed, you have options whereby you can have reconstructions right during the surgery.
Okay.
So that we remove your breast, but we reconstruct during the surgery. And reconstruction, they can use various things to reconstruct your breast. One can be your own muscles, you know, or we can insert a prosthesis inside.
A what?
Something like this,
but
it is inserted under the skin.
Okay.
Or you can have the reconstruction later, after you have healed, and later, then you can have some prosthesis being inserted under your skin just to, make your breasts.
So it's possible.
It is done every day in Kenya.
Okay.
Yes, very much.
Thank you for that.
My first question goes to Eunice. What was your family reaction towards your cancer diagnosis and how you coped about it? Second question goes to Mercy. What are the challenges that caregivers do face? Third question goes to the doctor. We have people from different levels who are diagnosed with cancer. What kind of treatment insurances do cover for them? Because cancer treatment is very expensive. And my last question goes to the media host. What does the media do about the cancer issue in Kenya?
Okay. Thank you. Mi yangu ni rahisi, naweza anza. Clearly we are just creating awareness, especially through storytelling. Like we have a story of survival right here. This is more than enough to give hope and inspiration to others. When you have your events out there, especially for this month of breast cancer, October, call us. Feel free to call us. We'll come cover just to spread more awareness. Hii TV nafikia hata wale mashinani. So as we have our experts right here, they get to talk to them, incite them in the best possible way and just give a feeling of hope and inspiration. Yes. So ndio maana tuko hapa for you guys. Yes.
Great.
Daktari.
I'll say most insurances cover breast cancer. It's just that most of the private have a limit.
Okay.
Have a limit to how much they can give you and for how long. But I must say that NHIF is covered. Cancer is one of the illnesses that is best covered by NHIF. It's actually the best, if I would say that. Okay. And it's also because of your lobbying, you know, the media just advocating and asking for cancer care. So it's actually the best covered. I don't think there's any other outpatient treatment that is well covered like NHIF. So I would encourage all cancer patients. I mean, that's one of the things even in our institution, you'll be told just get NHIF. Yeah. It covers for your chemotherapy, it covers for your radiotherapy. And not just that, it covers for your targeted therapy. Targeted therapy is often superior to chemotherapy, but also very expensive. So you'll be surprised. I mean, Kenyatta, even in Kenyatta, we have some of those drugs. NHIF will pay for you very expensive medication. So I encourage you.
It's really good to have a health insurance just in case.
Start with NHIF, but the rest is also covered. Yeah.
Thank you.
Challenges that caregivers face. Well, to start with, many caregivers do not know exactly what breast cancer is. So they start gap of teaching them what it entails, the risk factors, what they should look out for. Then you have patients where you have to deal with the patient's loss and grief. This is where you find that a patient has decided to have their breasts chopped off.
Yeah.
And okay, I didn't have to use the word chopped off, but forgive my French.
It's okay.
So when you get that, you have to deal with the patient's loss and grief. And apart from the patient, you also have to deal with the family. Say probably that she was married. The husband needs to know that it is not the end of her being a woman. Yeah? She is still a woman even with her breasts gone. So you have to deal with the loss and grief. Then you have to deal with the patient, the fact that sometimes they get very angry.
Yeah.
Very, very angry. When I say very angry, you really have to be patient with them. Yeah, I think that's basically it.
Okay.
Yeah.
Thank you. Eunice, I think there was a question for you.
There was a question for me, how my family took it. When I address the family, it depends on which family I'm talking about. My nuclear family, by that time I was married. My husband felt that because he had lost his mother to cervical cancer.
Oh, no.
In fact, he told me that the treatment of cancer is very expensive. And even if I go for the treatment, I'll finally die. So there's no need of going for the treatment. And in fact, he made it very clear that if I decide to go for the treatment, you'll not be there. So immediately I started my treatment, he packed and left. My other family, that is my sibling. I have one sister, I have 3 brothers. They really stood with me and walked me in the journey. And I strongly believe that is the reason as to why I'm here today. Because cancer treatment is very expensive. My husband left me. I lost my job, so I did not have a source of income. So my family really stood with me during those hard times.
And I hope employers are here listening to this story because...
Yeah, most employers believe that once diagnosed...
That's heavy, yeah.
And allow me just to
That's
mention,
heavy.
I think people tend to equate cancer diagnosis with a death sentence. And it looked like that because most of the people that we know that have cancer are either sick, either doing a harambee, or they have died out of breast cancer, and you're burying them,
Honestly.
So that's what most people know about cancer. The well patients, unless maybe 1 or 2 units and people in Kelele, they're not that many compared to the number of cancer patients that we have. So you find most patients who are doing well don't talk about it. They don't. Yet there are so many cancer patients who are doing so well, who are cured, who are going on with their life every day, and that creates a bias. So people need to know that cancer is not, it's really not, it
A death
must not be
sentence.
equated to a death sentence.
Yeah, thank you so much for sharing your story. Yeah,
Sorry.
maybe we can take one more question before we wind up the show.
This question goes back to doctor. Now, as you have said that many of the cancers is level of hormones, what about the small children? Like now when you go to the hospitals, there are so many children with cancer. Like I met in Kenyatta, a child was 3 weeks, was born with cancer.
Yes.
So the question was, how it has come, and that is a small baby.
No.
And like the area of adult people is clear because of hormones and age. Nowadays it is understood. What about the small babies?
That's a good question. So breast cancer is one of the cancers that's associated with hormones and maybe ovary as well. But the ones that you see in children are a bit different. Again, there are hundreds of different types of cancer. Not necessarily associated with hormones, depending on which type we're talking about, but we call them congenital. Some of them are just abnormalities that occur in your DNA or in your cells when you're forming, when the baby is forming. So mistakes happen during, after fertilization, when the body is forming. So you get some mistakes during that period. And then now as the child grows, you get cancer coming immediately after, if that is clear. So it's not necessarily the hormones at that time, no.
But for kids, we can also get those with breast cancer.
Very rare.
Very rare.
Very rare.
Okay, so it's other types.
Very rare. You get other types of cancer.
Okay.
Other types of cancer.
Okay.
It's a bit rare.
The other question is,
Thank you.
when the patients undergoing chemo, it brings down the immunity. And probably that is because of medicine or because of the food. Before they are put again the chemo, they are being returned back to wait till the number, the ratio, the range reach that they can get the second chemo. So what is the cause of the immunity going down, or after the chemo, what we can say about it?
Yeah, good question. So like I said, cancer treatment, especially chemotherapy, kills your fast-growing cells in your body. Cancer grows fast, so it will be targeted. However, the bone marrow, which produces your red blood cells and your white cells, which protect you from infections, takes care of immunity, also grow fast. So it's one of the cells that gets hit by a number of cancer treatment drugs. So what we do, we always monitor. You realize if you're going through therapy, the doctor will always say, before you come for the next cycle, do these tests. You must always come with tests, and then we monitor. If there's a problem, we'll probably give you what we commonly call a booster to raise your immunity, or sometimes to give you a treatment break. Maybe we extend, if it was supposed to be 1 week, we give you 2 more weeks just to help your bone marrow recover so that you get more cells. But it's something that usually happens worst during treatment, and usually after, you tend to recover to a good degree.
Okay. Thank you for that, Daktari. So one more question, and then we wind up.
Okay, my name is John Wangare, and I have a question to ask the doctor. What about the survivorship? Like, we have seen that Eunice has survived cancer and she has so much knowledge about cancer. How are you, as a hospital, are you going to integrate these cancer survivors to be ambassadors of speaking about awareness and maybe preaching out there that cancer is not a death sentence? Yeah, I'm also a cancer survivor.
Oh, congratulations.
Pancreatic.
pancreatic cancer.
Yeah, I
We are
was
happy to
treated in
have you.
Kenyatta.
Oh, nice. Eh?
Yeah,
We're happy to
great.
have you on set.
Yeah.
Yes, Dr.
So, first of all, let me just mention that outcomes are different because cancer is not one disease. There's someone who can come and have a very aggressive form of cancer and they die soon. But there's someone else who will come and stay for 37 years and even get cured of their cancer. So cancers are different, but also the stage which you get the cancer matters. The earlier they get it, the easier it is
To treat it?
to cure
Okay.
your cancer, and that's what we aim for. So I would encourage people to, as soon as you get symptoms or anything that's suspicious, as much as you're worrying and you're in denial, also just be diagnosing it. It goes a long way, because if you pick it early, instead of keeping away and going away for 2 years, then you come back when things are thick. It's better to come early and get treated early. About Kenyatta, just what are we doing in Kenyatta? We also try and do a lot of education to our patients. Normally in our waiting bay, sometimes the nurses educate people as a group. Then we have navigators, counselors, we have support groups, and there's a lot of teaching that goes on in those circles. And in fact, I really like patients after they have come a lot. They're actually very knowledgeable, you know, very knowledgeable. You just like to listen to them. In fact, sometimes they remind, Doctor, you have not given me this one, you know, and they understand their disease so well. So there's a lot of treatment education that goes on as well, and it's actually very encouraging.
So currently we are on the right trajectory.
Exactly.
Thank you so much. Thank you, Dr. Gloria. Thank you, Mercy. Asante sana, Eunice, for all the information you've given unto us. I hope this month has been great for you guys in terms of getting knowledge about the breast cancer awareness. And this has been Health and Wellness. My name is Zaitun Ali. In case you missed this episode, catch it on YouTube at KTN Home. On Twitter, the hashtag is hashtag Health and Wellness, hashtag KTN Welcome Home. Find us on KTN Home, at Ali_Zaitun on Instagram, and at Zaitun Ali on Twitter. Maybe tell us where we can get you, Daktari.
I practice in Kenyatta Cancer Treatment Center. You'll profile me in the clinic somewhere or in the ward. Usually.
And you, Mercy?
I'm Mercy Jim everywhere. LinkedIn, Facebook, Instagram is Mercy Jim.
Mercy Jim.
Yes.
And Kilele Foundation?
Kilele Health Association.
Oh, Kilele Health Association.
Yes.
Asante sana. And you, Eunice, I'm sure so many people would like to talk to you and at least find this inspiration. Where can we find
you? You will get me all over Eunice Wambua. You will still get me from any contact from Kilele.
Yes.
And you will still get me all over. In fact, Kilele sponsored us for a training as the survivors. We did psychosocial support. We'll be graduating very soon. At least for me, since I was not supported when I was doing my treatment, I'm a trained counselor. I can work with a patient. I can do counseling. So, for me, I'll be of assistance to anybody who is seeking for that assistance, because I walked through it the hard way. Singependa mtu atembee kama mimi.
Okay. My heart is full, and we pray for more grace to you and good health in abundance, and to every one of you who is a survivor out here in my audience and out there on my viewers' side as well. So thank you so much for joining us on Health and Wellness. Until next time, this has been Fairview Hotel in partnership with Good Life Pharmacy. Thank you, guys.